experienced was when we were in Mali this summer, we had a chance to work with community health workers just outside the capital of Mali, Bamako, in this town called Irimajo. And one of the community health workers, actually the head of the workers, her name was Ma Sise, and she went to introduce herself to a new family because they're supposed to make rounds and meet people. And when she went to meet the family, she saw a sick child, about 8 years old. And he was lying unconscious with his hands twisted. And he had been at the local clinic, but his parents were unable to pay for his care. So unfortunately, he had to come back. And then his father was cleaning off an old television set so that they could try and sell it and be able to afford care for this young boy. And Ma, who could see that his child was suffering from a severe case of malaria, immediately called an ambulance. And the ambulance came. They brought the young boy to the local clinic, and unfortunately they were not able to treat him there, so he then had to be brought further to a regional clinic. And there, Ma was really very distraught. She began crying when she saw him be taken out onto the stretcher into the hospital because he was so severe that she wasn't even sure if he was going to survive. And luckily he did survive, and he was able to get a transfusion, but actually the doctor had to go out and find someone to donate blood of the right type for the transfusion. So it really was quite a miracle, if you will, that all these factors came together to save this child's life. And Ma came back the next day. The child was doing better, and he was awake. He was able to see his family around him. And then Ma was in her rounds again the next week, and she saw him walking back from school. And so he went from being unconscious, hands twisted, to be able to go about his normal life. And all this took was a really small amount of money and just some basic medical care. So this gives you an example of how devastating it can be for a family